So I will present very quickly on the HIV epidemic in the Caribbean, and just to say that all of the information is taken from the UNAIDS website. Just to remind us of where we are globally, and so there are, at the end of 2023, almost 40 million people living with HIV. We had about 1.3 million new infections globally in 2023, and an estimated 630,000 AIDS-related illnesses, AIDS-related death, mortality. 88.4 million people would have become infected with HIV since the start of the epidemic, which is, just think about the numbers. 42.3 million people would have died from AIDS-related illness since the start of the epidemic. So it's sort of a snapshot of what's happening globally. Where we are in the Caribbean, this is not very good. But if you can pay attention to, I think it's the second row, you can see that for adults older than 15 years of age, the HIV prevalence at the end of 2023 is 1.0. And for adults aged 15 to 49, the HIV prevalence at the end of 2023 is 1.2. What I want to take a few seconds and really look at these two slides, and to make note that, earlier on when we talked about the HIV epidemic in the Caribbean, we would always say that we're the second most affected region in the world, right? You remember that? It's in every narrative that we had, that we're the second most affected region in the world. But if you look at these two slides, you can see, for example, if you take the first slide for adults over the age of 15, you can see that there are other regions, so there's West and Central Africa that has a prevalence of 1.3, and the Caribbean has a prevalence of 1.2. Certainly, East and Sub-Saharan Africa continues to be the most affected region in the world, but you can see a little bit of a shift in terms of that narrative that we had earlier on, where we were the second most affected region in the world. We still are the second most affected region in the world, but there's a little bit of shift globally in terms of the different regions. In terms of people living with HIV, at the end of 2023, there's 340,000 people living with HIV in the Caribbean. And you can see the breakdown in terms of the different age group. So for children 0 to 14 years, it's about 11,000. Adolescents between the age of 10 to 19 years, it's 10,000. Young adults between the age of 15 to 24, it's 27,000. And adults aged 15 years and above, 330,000. If you can pay attention to the very last row, which I want to draw your attention to, for adults aged 50 years and over, you can see that there is an increase in the number over the years. For all of the other age groups above, you would see that there has been that has been stable. But if you look at the older age group, you can see that the number has been going up. So that can mean many things. But it also means that it could mean that people living with HIV are growing old, and so we're having an older cohort. But it also means that we have to talk about comorbidities, and I know that a discussion has started in the region. At PANCAP, we have already had several webinars. The most recent one was on HIV-associated neurocognitive disorders. We had one before that spoke to HIV and aging. And so this is something that we have been hearing from our stakeholders, from the community of people living with HIV, to say we need to be talking about comorbidities. And so I think it is very clear. In fact, we have heard also from the community of women living with HIV. It's not just about comorbidities, but it's about comorbidities and women living with HIV. And so I just wanted to really draw your attention to that part of the statistics. In terms of new infections, we know that there has been a decline in new infections from 2010 to 2023 by 22%. But to say that almost 90% of the new infections that occurred in the region in 2022 were in Cuba, the Dominican Republic, Haiti, and Jamaica, with Haiti alone accounting for 38% of the new infections. And so while there is a reduction in new infections, we know where the new infections are coming from. And in terms of key populations and their sex partners, they continue to account for a significant proportion of new infections in the region. And so at the end of 2022, key populations and their sex partners accounted for 47% of the new infections. So that's where the new infections are coming from, almost half of the new infections. In terms of the key populations, we know that we have a generalized epidemic in the Caribbean, but we have concentrated epidemics of key populations. And so I wanted to share this slide in terms of where we are in 2023, and what is the average estimated prevalence of key populations in the Caribbean. And while we say it's probably the median HIV prevalence in the Caribbean, you would notice that, let's take the sex worker, for example, N equals 3. That's report coming from just 3 countries in the Caribbean. And so certainly from this slide, you can see that the most affected key population would be the transgender population, with reports coming from 2 countries in the region to UNAIDS. And so the transgender population HIV prevalence, the average is 31.3%. So very high prevalence among our key population. And what the last bar is showing is, again, the adult prevalence of 1.2. So if you compare the 1.2 to what we're seeing for the sex worker, gay men, transgender people, people in prison, we know who our key populations are. So when we talk about prevention and key population, what I wanted to share with you on this slide is how well we have provided differentiated services, prevention services to the key population. And so again, this is UNAIDS. This is based on a report that countries have shared with UNAIDS. And the way differentiated services has been defined, so looking at and I can't see it from here. So there are 4 key variables that UNAIDS has used to define differentiated services. I think the first one is the enabling environment. The second one is health systems. The third, scope and scale of services. And fourth is key population, ART peer support, and testing services. And so based on those 4 broad categories, where are we in the region? And you can see, for example, when it comes to the enabling environment, what the report is saying based on your submission is that 9 countries in the region, there's an urgent need to address stigma and discrimination and to really have an enabling environment. And I think Dr. Omar alluded to this in his presentation on the IAS. When you look at scale and scope of services, there are, I think, 5 countries where there's an urgent need to address the barriers. So if you can take a moment to just look at what the colors are saying, you will get an appreciation of where we are with differentiated services to prevention. And while we'll talk a lot about integration over the next 2 days, differentiated service delivery to particularly the key populations is also very important in terms of access to services. So an additional element to PrEP, and Dr. Omar spoke about PrEP, and Kevin, I think, did a wonderful job in raising the issue of PrEP. This, again, is based on UNAIDS data, and it's based on UNAIDS data that you have submitted. So if you have more people on PrEP, you can let us know. But this is what it's saying. And for me, the message here is that, 1, we have started. 2, there are more countries that are putting people on PrEP. And 3, by the end of 2023, I think we have a substantial number of people on PrEP. There are still significant gaps, and we'll hear about them over the next 2 days, but certainly there are more people on PrEP in the Caribbean. In relation to stigma and discrimination, and I'm trying to touch on some of the topics that we will be looking at over the next 2 days. S&D continues to be a significant hurdle to access the services. Some of these studies are a little bit old, 2016, 2015, but we have some newer studies that came out from Haiti. But you can see that stigma and discrimination towards people living with HIV continues to be high. So for example, in Barbados, it's 46.4, in Belize, 36.9%, in Cuba, 24.4%, the Dominican Republic, 41.9%, in Guyana, 40.6%, in Haiti, 71.7%, and in Suriname, 66.4%. And so these are based primarily on some mixed surveys and on some IBBSs where those surveys apply the questions around stigma and discrimination, whether you'll buy from a vendor or whether there has been discrimination from a teacher, those kinds of questions. Some of the more recent IBBSs have included questions on experiencing HIV-related S&D in the healthcare setting. And I know we will talk about S&D in the healthcare setting, but this is really very pleasing to me to see that when you look at discrimination in the healthcare setting, it's actually lower than we're seeing in some of the other settings. And again, these are from more recent IBBSs, and in this instance, these are from stigma index surveys where people living with HIV are giving their feedback. And so in recent studies in Haiti in 2021, 1.4% of people living with HIV said that they've experienced some S&D in the healthcare setting, and in the Dominican Republic, 13%. On the other hand, if you look at S&D in the community setting, it's actually higher than what we're seeing in the healthcare setting. And so, it's still an issue in the healthcare setting, but I think it's really interesting to note this. What continues to be of concern is the internalized stigma, and we will have a session on internalized stigma over the next 2 days. And so you can see from the Dominican Republic and Haiti and Jamaica, this continues to be a major concern for internalized stigma. On the other hand, despite the levels of stigma, access to redress or seeking redress from people living with HIV continues to be relatively or comparatively low, but still, I think, good numbers. For Belize, 19.7%, the Dominican Republic, 15%, and Jamaica, 22.5% of people who have experienced stigma have come forward seeking redress. And in terms of avoidance of healthcare services because of stigma and discrimination, like I said, Haiti had recently had a survey, which was last year, and 11% of female sex workers avoided healthcare services because of S&D in the healthcare setting, and 10% of MSM. So a lot for us to think about in terms of stigma and discrimination, because there's an entire session that's dealing with stigma and discrimination. In terms of where we are with HIV treatment and testing cascade, so 85% of people on the first 90, 70% of persons who are living with HIV on treatment, and 61% of persons who are virally suppressed. So we're making progress in terms of people getting tested, but of course there are gaps. 85% of people, we need to do much more to get people tested. And there's an entire session that will speak to innovation in HIV prevention. More people are accessing treatment, and 61% viral load, so a lot more to be done in terms of viral suppression. But what I want to turn your attention to, and Dr. Omar spoke to it in one of his slides, is the gap between adults and children. And you can see the last set of columns, which is children aged 0 to 14 years of age, that it's compared to the total HIV population and compared to the male and female adult population, there's a significant gap between the adults and children. I don't have a slide on EMTCT because I know EMTCT will come up, and Dr. Omar alluded to the fact that there is the gap in the EMTCT program, but that the Caribbean has been doing really well. But these, again, are the estimates coming out from UNAIDS, and a lot of these estimates in terms of the gap for children may very well be in some of our larger territories, but I'm sure that it will generate some discussion in terms of some of the smaller territories. AIDS-related death, we have seen, I am sorry. Do I go back? We have seen a 57% reduction in AIDS-related deaths. I think that's good news. More people are accessing services, more persons are going on treatment, and so we're seeing a 57% reduction in AIDS-related death. In terms, this came a little bit later. But in terms of the HIV testing and treatment cascade, what I would like to really draw your attention to, this is from 2019 to 2023, it's that there has been an increase in the percentage of people who know their status, which is 85% at the end of 2023. But if you look at the other blocks in the last column, you will see that there still remains issue with viral suppression. There still remains issue with late diagnosis. And so those, again, are some of the things that we will talk about in this meeting. In terms of treatment, just to talk about differentiated service delivery again, here are the 4 components of differentiated service delivery for treatment that UNAIDS has defined, which is the enabling environment, health systems and program response enablers, scope and scale of service delivery, key population, art support and testing services, and very similar to prevention, significant gaps in terms of the enabling environment and health systems. So in summary, we have 330,000 people living with HIV. There's an increase in the number of people living with HIV who are older than 50 years of age, and again, implication for the management of comorbidities. Late diagnosis remains an issue. While I did not have a slide with the specific, we have been hearing that late diagnosis continue to be a problem, and so there are implications for how we diagnose earlier, and more importantly, how we manage advanced HIV disease. There's significant levels of S&D, especially when it comes to internalized stigma and discrimination, and we have seen in the community setting. S&D continues in the healthcare setting, continues to be a deterrent in terms of access to services. Despite progress in terms of testing, bringing on new modalities of testing, putting more people on treatment, we still have significant gaps in terms of the 95, 95, 95 and the treatment and testing continuum. What I didn't mention in one of the earlier slides, in terms of the testing and treatment continuum, there seems to be better progress among women compared to men, and so men are being left behind somewhat. The DSD strategies and for prevention and treatment are at different stages of implementation, but certainly we have seen that the enabling environment is a big component that needs to be addressed. There's good uptake of PrEP in our countries, but still there's a significant gap in terms of PrEP across the Caribbean. And so with that, thank you.